Additionally, I would like to take a moment to thank our program sponsors, UCB and SK Life Science. Their generous support has helped us underwrite the cost of hosting today's program. Please visit our sponsors' websites or contact the local rep directly. And the information will be shared at the end of the seminar via email. Now, I'm honored to introduce today's speaker, Nicole Woodrich, who is a doctor of pharmacy at Cleveland Clinic. In today's seminar, you will learn about medications in epilepsy, herbal supplements, over-the-counter, and prescription medications. I'd like to turn the program over to her, and she can present on this important topic. Thank you, Nicole.
It is a pleasure to be here. Let me just share my screen and then I will go ahead and get started. Are you able to see my screen?
Yes.
Okay.
Yes.
Beautiful. All right. So as she mentioned, my name is Nicole. I'm one of the epilepsy pharmacists here at Cleveland Clinic, and I specifically work in the ambulatory care setting. So I get to see quite a bit of patients, get quite a bit of questions from various providers. And I will say this is a great topic because I get quite a few questions in this area. So today we'll be talking about herbal supplements, over-the-counter medication, as well as prescription medications. So today's objectives are to discuss the important factors to know about anti-seizure medications. We'll talk about over-counter medications, prescription medications, and herbal supplements and how they may impact seizure medication levels, impact the risk for seizures, and can be impacted by anti-seizure medications. And then we'll additionally review the limited information we have available for herbal supplements and over-the-counter medications in regards to seizures. So as an epilepsy pharmacist, I will not be able to present without talking a little bit about anti-seizure medications. So we'll review and get some good baseline knowledge before we talk about some other medications and how our anti-seizure medications can impact those other medications and vice versa. So how do anti-seizure medications work? So let's take a step back and think about how a seizure is going to occur. So this will be an increase in electrical activity in the brain. So how I think about it is a neuron gets excited, excites the next neuron, and continuing on, which can create that seizure to occur. So overall, I think of it like a car. So we have too much gas, or what a provider or doctor may say excitatory, or not enough inhibitory or brake. So that's typically what we'll see when a seizure occurs. So those neurons are very, very excited and nothing is stopping them. So just like if you put pedal to the metal to a car, you're going to go very fast and you may cause a collision if you don't have that brake or you're able to pull off that gas. So medications are going to work to prevent those seizures by increasing the brake or working on that inhibitory pathway or slowing down the gas or decreasing that excitatory pathway. What I think it's important to note is that medications do not cure epilepsy. They're going to help prevent the seizures. So if we think of the car situation again, so if we have a medication that's helping put on that brake, we remove that medication, that brake is off, and now you're going to continue on having those seizures. So it's very important to know that the medications are really helping to prevent those seizures, not curing what's causing the seizures. So how effective are our anti-seizure medications? So some anti-seizure medications work better for certain seizure types than other seizure types. So someone that may have generalized epilepsy, I may pick a certain medication for that patient versus a patient that may have focal epilepsy or Lennox-Gastaut or Dravet syndrome. So various different types of epilepsy. As a provider, we may specifically pick certain medications over the other, or maybe avoid certain medications, as certain seizure medications can help one seizure type but hurt another seizure type. So it's important to note that medications work for about 2 and 3 patients with epilepsy. So if we have 3 patients, our first patient here is on levetiracetam 1,000 milligrams twice a day, seizure-free on that regimen. The next patient tried levetiracetam, had some mood side effects to that one, so was started on lamotrigine. That was increased, and the patient still had seizures, so a second medication was added, zonisamide. Patient is now seizure-free on this regimen. The third patient still has breakthrough seizures despite trying 7 other seizure medications and being on 3 seizure medications, so zonisamide, clobazam, and cenobamate. So 3 medications, still having seizures, and failing or trialing 7 other seizure medications. So not all regimens are created equally. So just because a medication works for one person does not mean it may work for another person. And some people may require multiple seizure medications or a specific cocktail or combination of seizure medications to best control their seizures. So how do medications reach the brain, or how are we going to get that pill to help control our seizures? So if a medication is taken orally, it's going to go down into the stomach. The stomach is very acidic, so it's going to start breaking that medicine down, and then some of it, in some circumstances, will be absorbed, but the majority of it is going to be absorbed in the intestine, specifically the small intestine. And when I mean it gets absorbed, it's going to be entering into the bloodstream. And that's when you can get drug levels and see the levels in the bloodstream. And then the blood is going to enter into the central nervous system, or some of those particles are going to be going to the central nervous system or the brain. So the medications have to have a certain chemical structure that allow it to pass what we call the blood-brain barrier to allow it to enter into the brain or central nervous system. And then once it is having its effect, it's going to be cleared, typically through the liver or the kidney. So that's how it's going to get out of the body. Then you take your next dose, and then this whole process continues on again. So aside from medications being taken orally, as you can see here, there's lots of different ways that medications can be administered. So the first is going to be intravenous, or most people think of IV medicines that are given in the hospital. So that's one formulation that can be given. Not all of our seizure medicines have IV formulations, but some do. Some medications can be given intramuscularly, so into the muscle, and that's typically some of our rescue medicines. So if the squad or EMS comes for a breakthrough seizure that's prolonged or a new seizure, they may administer a rescue medication intramuscularly. Medications can also be administered via oral liquid. So some of our seizure medications only come in liquid formulation just due to the dosing, as well as the chemical structure only allows it to be in the liquid. And some medications come in liquid form as well as tablet and capsule form. What's important to know about the liquid formulation is that if it's a suspension, meaning that you see the liquid on top and then you see the powder or medication on the bottom, that's important to shake that so you have equivalent medication throughout that whole bottle, and that dose is going to be the same. And then medications can come in solution that don't require that shaking, so it's consistent throughout that whole bottle. Some medications can come in oral film. So some of our rescue medications, clonazepam, can come in oral film, and then clobazam also has an oral film that's going to be dissolved under the tongue. Some of our rescue medications can be administered via the nasal area. So that can be, that's demonstrated here in that picture, where you'll press the plunger, and that's when the medicine will be administered in the nostril. And that can help typically for rescue for clusters of seizures or prolonged seizures. So these are going to be our benzodiazepines that are in this formulation. So rescue, not necessarily doing this formulation scheduled every single day. Our old tablets and capsules are typically going to be those scheduled daily medicines to help prevent those seizures. So our capsules are do not crush or do not split. So those medicines should not be split or crushed just because they have that coating on the outside. There's different ways or different types of each oral capsule, so they can be extended release. And extended release medications ultimately release slowly throughout the whole day or throughout that certain time period to help limit some peak, what we call peak side effects, where the medicine's high in the system. There's also delayed release formulations, which ultimately, as you can imagine, are delayed in when they're being absorbed. So the stomach is starting to break it down, but it's not necessarily getting absorbed until later. And this typically helps with GI or stomach upset, nausea, vomiting, those types of side effects that someone may experience. It typically helps with those. And then immediate release formulation is going to be the really bread and butter of a lot of the medications that are prescribed. Oral tablets are another formulation that can be used and are very, very common. This one also comes in extended release formulation. And tablets can typically be crushed unless it's the extended release formulation. Those ones we typically do not crush or split because there's that coating on the outside that ultimately helps to slowly release that medicine throughout that time period. There's also immediate release, as I mentioned. There's chewable tablets as well as dissolvable ones as well. So lots of different ways someone can take a medication to help either treat the seizure or help to prevent the seizures. So another question is, why is it important to take medications as prescribed? Why is my doctor telling me to take this medicine 3 times a day and my other one is only once a day? And this is because medicines are dosed based on how long they stay in the body. So from a pharmacist perspective, we always think of what this is determined as, which is the half-life, which means how long it takes for the body to cut that medicine in half and clear half that medicine. So that longer half-life medications are dosed less frequently, so they may be dosed only once a day. And then our shorter half-life medications, where they don't stay in the body long, must be dosed more frequently, so twice a day or 3 times a day. So what happens if you miss a dose of your medicine? So say you take it every single day at bedtime. If you miss that bedtime dose, this will lead to low levels in the system, putting you at higher risk for breakthrough seizures. And what happens if you take a medication late? This will ultimately lead also to low drug levels in the system. And if you take it very close to that next dose that's due, you can have increased risk for side effects as well. So that's why, life happens, but it is very important to try to take them as prescribed to really best control the seizures as well as limit those side effects. So as I mentioned, life happens. We can all miss a dose of medications. So what do you do if you miss a dose of your seizure medications? So this is when you should take it as soon as you remember. But if it's close, more than halfway typically is the rule of thumb to your next dose, then just take it as scheduled. Typically, it's not recommended to double the dose. Again, this can be provider specific or situation specific. And if there are any specific questions for missed doses, you can always just call your doctor's office as well. So just an example here, you take, let's say your lacosamide twice a day, 8 a.m., 8 p.m. You realize, you look at the clock and you're like, oh no, it's already 11 o'clock. I see my pill box and I see that morning dose still sitting there. You can still take that morning dose of lacosamide since it's still close to that morning dose and far enough away from that bedtime dose. Say you look at the clock, you still didn't take it. It's 4 o'clock now, so it's getting close to that bedtime dose. It's more than halfway until your bedtime dose, so that's where you may consider skipping that and just taking it as scheduled from there on out. So how do we try to limit missed doses of our seizure medications? Because we just talked about lots of risks with missed doses or late doses. So the weekly pill box, I will say is my favorite. So this will help remind you and let you know if you missed a dose. Because if it's, say Tuesday morning, and you look at your Monday night and you're like, oh no, that pill's still in there, that will tell you and allow you to reach out to your provider or know if you have a breakthrough seizure that could have been maybe a trigger for that breakthrough seizure. So it can help remind you and let you know if you miss doses, or it helps prevent doubling the doses. If you can't remember, oh, did I take my morning medicines today or not? You can look in there and it'll be gone if you took it and not if you didn't. So those are very helpful to help kind of, like I mentioned, remind you to take them and remember to talk to your doctor if there are any breakthrough seizures or if you did miss any doses. The second way you can utilize to limit these missed doses is alarm on the phone. This is only helpful if you don't snooze the alarm or cancel the alarm without taking it. And there's many other applications on the phone that can send other messages or alerts on your phone to remind you to take it. And then you can also track every time you take it. And again, this can help you and your provider know if there's, a trend for more missed doses recently, or increased seizures right around those times of missed doses. This can also help the provider adjust medicines appropriately. Also, taking medicines as a part of routine is very helpful too, and at the same time each day is very helpful to get in the routine. So say you just can't get a hold of taking your medicines scheduled, you still are missing quite a bit of doses, try to put it with something that you never forget doing. So say you're always, brushing your teeth, getting your pajamas before bedtime, add that pill around that area or something, either by your nightstand or in the bathroom, so you can remember to take it during that same time of that routine. Again, try to do it at the same time each day. And then additionally, when you're not home or kind of out of that routine, you can always bring some of the medications along with you. So some of the pill boxes have doses or spots where you can pull them out and then take that little section of the pill box with you for where you are out of home or away from your medicines. And another way where I see patients miss quite a bit of doses is the pharmacy doesn't have it in stock. So ways to limit this is call your pharmacy a week in advance. A lot of the seizure medicines are not kept in stock just because they're expensive. They're not commonly used, some of the seizure medicines, so they may not keep them in stock and may require you to call every time you need a prescription. So this gives some buffer room for the pharmacy to order it in, to let them know if they can't get it in stock, etc., and then allows you some time to pick up the medicine before you're completely out and in a pickle, calling the office, asking what to do because you're out of your lacosamide for 2 days. And then another important thing with missed doses is to never stop an anti-seizure medicine before talking to your doctor first. If a medicine is just not working for you from a side effect or seizure standpoint, call your doctor and let them know, and they can find a safe way to ideally come down on that medicine. Because if you cold turkey stop the medicine, that will put you at very, very high risk for seizures, and then even more so bigger seizures that you may have not had before, or prolonged seizures. So you may notice that doctors or providers may order a blood test for your seizure medicine. So this is a drug level that can help really determine if there's too much or too little medicine in the body. And this is extremely helpful if there's drug interactions. So seizure medicines not playing nice with each other medicines not playing nice with your seizure medicines, that may cause some fluctuations in levels. And then additionally, if you have side effects, we can check those levels to see which seizure medicine we may need to point fingers at. Additionally, drug levels, I think, is important to know that you should take it or take that drug level before your next dose is due. So typically, when I recommend a level for a patient, I typically recommend try to go early in that morning before your morning doses of medicine are due. Take your medicine with you because it's out of your routine to get those labs in the morning. So take that dose with you and take it right after that lab is drawn. And this is really allowing us to get that lowest amount of drug in your system, which is what we want to know, because that low level is where patients are typically highest risk for breakthrough seizures. And that's typically what the normal range is. So when you look on your MyChart or other health system record, you see that normal range for a medicine. That's going to be that trough or lowest level in your system. So say you forget, you take your medicine in the morning, you get your lab 2 hours later, the level's extremely high and you freak out because that level's high. That, from my perspective, isn't telling me too much. It's just telling me you took your medicine and it got absorbed. It doesn't tell me much from what that normal range is or if it's a normal range. So that's why we should try to get the lowest amount in the system. And if that's not feasible, then you work with your provider to try to get the best time for that. And the last thing we'll talk about before we talk about some of the other discussion points today is that anti-seizure medications do not always play nice in the sandbox with seizure medicines and also with other medications, which is why we're really having this topic discussion today. So say we have here valproic acid playing in the sandbox just fine by himself. We have another sandbox over here. Lamotrigine was all by himself. Valproic acid came in the picture, not playing nice with each other. And what I mean by that is valproic acid is going to double that lamotrigine level, which can put patients at very high risk for side effects if we don't appropriately address it. So how do we get them to play nice with each other? We're going to decrease that lamotrigine dose, and now they're happy. Both levels are in range, and they're working very well together to help prevent those seizures. So this is true not only with these two medications, but a lot of our other seizure medications, we can see those fluctuations in levels. So levels going up, levels going down. And again, this is not only true with our anti-seizure medications, but also many other medications that patients with epilepsy may be taking. So that's it from an anti-seizure medication background standpoint. So now we'll move on to prescription medications that are not related to epilepsy and how they may play a role with our seizure medications, and how the seizure medications may play a role with them. So as an epilepsy pharmacist, I think of some red flag medications that anti-seizure medicines may impact. So these are red flags in my mind that I think let me double check a drug interaction, or if I know the drug interaction, let's reach out to the provider and try to figure out something to help with this drug interaction. So the most important one I think of is anticoagulation or blood thinning medication. So this can be our Coumadin or warfarin. It can be apixaban or Eliquis, or rivaroxaban or Xarelto. So those are our most common 3 blood thinning medications that our seizure medicines can sometimes impact. So with this, these anticoagulation medications are used for some high risk comorbidities. So those can be blood clots in the lungs or legs. They can be treating or preventing stroke from atrial fibrillation. So we want to make sure those medicines are working good, so we don't have a stroke and leading to post-stroke epilepsy, or we don't have a clot that's impacting your ability to breathe. So we want to make sure that these anticoagulation medicines are working well, levels aren't too high and levels aren't too low. If levels are too high for the anticoagulation, you'll be at higher risk for bleeding. If they're too low, you'll be at higher risk for those clots. So we need to make sure those seizure medicines aren't impacting those levels of the anticoagulation. The same is also true with HIV medications and hepatitis medications. So HIV medications, some of them do not play nice with some of our seizure medicines, and we need to treat HIV and hepatitis. We don't want that infection getting worse. We don't want any resistance with those because they're not properly being treated. So we need to make sure those anti-seizure medications are playing nice and not impacting or decreasing the levels of those HIV or hepatitis medications. Some of our anti-cancer medications can sometimes impact our seizure, or can be impacted by our seizure medications, making them a little less effective. We don't want your anti-cancer medications being less effective because we don't want the cancer to spread. So this is why we need to make sure those 2 are playing nice as well. Additionally, medications for mood can be impacted by anti-seizure medications, and patients with epilepsy are already at higher risk for some mood disorders such as depression, anxiety, etc. So we want to make sure that we're not causing the medication that's used for depression to decrease in levels. We want to make sure that's being appropriately treated. So overall, from an anti-seizure medication standpoint, it's very important when your doctor says any new medications that have been started, or if you start a new medication, always letting the doctor know so we can make sure that everything's playing nice and there's no concerning drug interactions. Because from an epilepsy standpoint, we want to make sure that we are treating the epilepsy, but also as a provider, we want to make sure everything else for you is being treated appropriately. So I mentioned how our anti-seizure medications impact our other medicines, but how can our other medicines that we're taking impact our anti-seizure medicines? So some of our prescription medications can impact or interact with our seizure medications, causing either a high or low level. High levels of our anti-seizure medications put patients at higher risk for side effects or toxicity. So they may be excessively sleepy if the level is high, or they may have dizziness, unsteadiness. And then if we have low levels, so say that other medication is clearing or getting rid of that seizure medicine way too quick, the patient's going to be at high risk for seizures with that low level of anti-seizure medicine in the blood. So with this, I'm not listing a specific example here because there are lots of different examples, but I think it's important to know that if it's a non-urgent medicine that needs to be started, if you're able, I would say try to talk to your epilepsy doctor before starting those non-urgent medicines. Now, if you're in the hospital, something needs to be started, you have an infection, start it, and then talk with your doctor after. We don't want to delay any administration of the medicine. Or if the doctor that's prescribing the medicine, let them know that you have epilepsy and you're on a specific medication, and they can also run a drug interaction as well. And then lastly, for prescription medicines, how can prescription medicines not only impact our seizure medicines, but how are they going to impact seizures? So the main one, there's lots of different examples I will say, but the main one I think of that I get questions on is antibiotics. So some antibiotics, specifically our beta-lactam antibiotics, that are used to treat infections can also impact seizures. I also think it's important to note that seizures can be impacted by infections. So patients that have infections that are not treated can worsen seizures. So overall, it's important to treat that infection. So we need to make sure that we keep an eye on seizures, use that antibiotic to treat the infection, and just like I mentioned, keep a very close eye on seizures. I've never recommended avoiding an antibiotic in that patient setting because we don't want that urinary tract infection to spread to the kidneys, to spread to the blood, and now you're in the hospital. So treating the infection is very important. And some people are worried because they'll Google the medicine and the antibiotic and see that it can impact seizures. But again, we want to make sure we treat that specific bug or bacteria with that specific antibiotic that the doctor wants to appropriately treat it. And then again, just monitor for increased seizures, or if you're concerned, you can always reach out to your doctor or epilepsy doctor to make sure they're aware and okay with that. And then birth control, which is again, both over the counter now as well as prescription. So we'll highlight a little bit about birth control, not only how seizure medicines impact it, but also how they can impact our seizure medicines. So anti-seizure medicines that impact birth control's effectiveness are listed here. So there's quite a few. So these medications, these anti-seizure medications, are going to decrease the effectiveness of birth control. And what that means for the patient is that they may be at higher risk for pregnancy or that lack of effectiveness of that birth control. And this is not only the oral birth control, so the pill, which can include the progesterone-only pill, the combination of the estrogen and progesterone, but it also can include the patch, the ring, and then the injectable progesterone formulation and the implant of progesterone that's placed in the arm. All of these can be impacted by some of those seizure medicines listed on that previous slide. So patients just need to be aware about this interaction and discuss with their provider if there's concerns. The only form of contraception, aside from sterilization, would be the IUD that does not interact with those seizure medicines on the previous slide. So that's the intrauterine device, or IUD. And those one exerts its effect locally, which means that it's not going to be impacted or have decreased levels because of those anti-seizure medicines. So what happens if you're on one of those medicines, you're on contraception, and you do not want to plan on getting pregnant? How do we manage those interactions? So typically talking to your doctor to see if there's a different anti-seizure medication that does not interact and would be appropriate to treat the seizures. Now, if you're on a medication, you've tried lots of other medications, this is the only one that's working for you, that's when we would maybe figure out a different form of contraception that is not hormonal or that IUD formulation that can be utilized. So barrier methods, which are listed here on the bottom, that can be utilized. So those are not going to be impacted by our seizure medications. And then intrauterine devices, as I mentioned, either the copper or the hormonal, can be utilized that are not known to interact with our anti-seizure medications. So like I mentioned, there's a couple different options that we can work with the patient on to allow for that contraception to work better, as well as switch to a different anti-seizure medications if there is that interaction. So the last portion of this with hormones impacting our seizure medicines is lamotrigine's interaction with estrogen. So this can come up quite a bit, not only for females of childbearing age, but patients that are using hormone replacement or utilizing estrogen for menopausal symptoms. These all, no matter what or how they're used for, can impact those lamotrigine levels. So lamotrigine can decrease by about 50% with estrogen use, which puts patients at higher risk for seizures. So if a patient is starting estrogen, they're on lamotrigine, or if they're stopping estrogen and they're on lamotrigine, it's important to keep an eye on those levels and adjust appropriately. So this example here is listed on the bottom. So you have a patient on lamotrigine, the level is at 10. Anytime it drops below 10, they may have a breakthrough seizure at higher risk for seizure. They started estrogen without telling their provider, and that ultimately decreased their lamotrigine level to 5. So it decreases that level very significantly. Estrogen doesn't change, so we're not, decreasing or increasing that level, but it does impact that lamotrigine. And the same would be reversed. So say a patient is on estrogen and lamotrigine, we remove that, then they're going to be at high risk for side effects due to that lamotrigine level almost doubling. So that's important. I would say females of childbearing age or anyone on estrogen and lamotrigine, keep a close eye on that and keep in touch with your provider if you are starting or stopping that or even adjusting the dose of that estrogen. So now we'll talk a little bit more about over-the-counter, specifically cold and flu medicines, which is a perfect time to talk about it now since many people are sick with this current season. So for various things you may see over the counter, this first one we'll talk about is cough. So if patients are coughing, staying up overnight, having to cough, or coughing fits throughout the whole day, dextromethorphan is an option. This is typically safe with low over-the-counter as needed doses. You may see that there are some reports of seizures with this medicine, and this could be typically when it's going to be dosed at high doses, or even if there's an overdose, you drink the whole bottle, very high risk for seizures at that time. But I would say low doses are typically okay. And again, double check with your provider if you are very sensitive to breakthrough seizures. For congestion, specifically nasal congestion, people may think of phenylephrine, pseudoephedrine, or Sudafed is the brand name. These, I will say, I typically recommend avoiding if able, because this can put patients at higher risk for seizures because they're more of a stimulant type medicine. For pain or fever, so if you have any of those flu pains, muscle aches, things like that, or a high fever, Tylenol or acetaminophen can be utilized. This is not known to impact seizures, can sometimes impact with lamotrigine, but this is when you use very high doses for multiple days of these high doses per day, is where we may see that interaction with lamotrigine. For ibuprofen, seizures are not known to be impacted by ibuprofen or the brand name Motrin, but it can sometimes impact or interact with the valproic acid if you're on that, or phenytoin as well. Again, more scheduled doses, so using it very frequently. For these two medicines, I will say some comorbidities or some other health conditions may restrict the max dose. So specifically for the acetaminophen, we may avoid higher doses or total daily doses high in patients with liver failure. And for ibuprofen or Motrin, we may avoid using it if they have a history of renal failure or kidney disease, or if they have a cardiac history on blood thinners or have heart failure. And then the last one is for mucus. So this is going to help break up the mucus. So say it's, you're very congested, kind of down in your lungs, or it's hard to cough up that mucus. Guaifenesin is used to help break up that mucus. And this one is not known to impact seizures. So this one is typically safe for patients with epilepsy. What else do we need to know about cold and flu medications? I think the most important, no matter epilepsy or not epilepsy, is being mindful of our cold and flu products containing multiple ingredients. So listed here are two on the right, and they contain 4 ingredients. So say you're taking this product with these 4 ingredients that contain acetaminophen. You don't know that it contains acetaminophen because you didn't read the label, and now you're taking acetaminophen on top of that. So you're taking extra and double the dose of what's actually recommended. So I think it's very important to look at those active ingredients, make sure you're not doubling up or taking multiple products is definitely important. And then illness, I think, is important for patients with history of seizure. That illness can sometimes be a trigger for seizures, whether they are or are not on antibiotics, whether it's viral, bacterial infection. So usually keep in touch with your provider if you notice that seizures increase, especially if you're not feeling well or have an illness. And then ways to prevent illnesses. So vaccine, it's important to stay up to date on vaccines to help prevent these illnesses, because if we can prevent a trigger for a breakthrough seizure, that's always a win in my book. So vaccines can be utilized to help that as well. For additional over-the-counter medications, we'll talk a little bit about our allergy or antihistamine medications. So there's really 2 groups that we'll talk about. So the first one is our first generation antihistamines. These are called more of the drowsy ones. So you may take these at bedtime. These medications are going to work by reducing the action of the histamine, which is going to be in response to pollen, pet dander, dust, etc., or it can be used in allergic reactions too, the non-severe ones, where you may notice hives or things like that without throat or tongue swelling. So these can be utilized to help limit some of those symptoms. So typically the symptoms may include congestion, eyes runny, etc. And the main two that we typically see over the counter is diphenhydramine and doxylamine. These are not only contained in sleep aids, but you may see them, as we saw before, in those cough and cold flu products, in allergy medicines, and then anti-nausea medications as well. Typically, we recommend to use these with caution. So some people have been using them. They don't notice any increased risk for seizures with them, but some people may notice an increased risk for seizures. So these are always used with caution, and then usually in conjunction with talking with your provider to make sure that they're okay with you utilizing those. And the reason why they're thought to increase or impact the seizure threshold or impact the ability to have a seizure is because, like we talked about before, some of those chemical structures can allow that medication to pass through that blood-brain barrier into the central nervous system, into that brain, impacting the seizure. Our second generation antihistamine medications have a little bit of a different chemical structure, so they're not as drowsy, or the non-drowsy ones, because they don't cross through that blood-brain barrier as much as the other medications we just talked about. And these medications include loratadine, or fexofenadine, or Allegra, people refer to that as for the brand. And these are less likely, as I mentioned, to enter that central nervous system. They're generally safer for patients with epilepsy, but there are still some reports for potential for breakthrough seizures with this medication. So it is important to just keep an eye on this, let your provider know if you do utilize these. And then again, just if you noticed an increase in seizures and you are using this, and you didn't have those increased seizures without it, then that's again where you would talk to your provider. I will say these all are a little controversial, so depending on who you ask, you may get a different answer. But I will say the least controversial allergy medicine is going to be the nasal allergy medicines. So those ones are going to not be what we call systemically absorbed. So those are going to be not impacted or absorbed into that blood-brain barrier. So that's why those are going to be my favorite, because they have that lowest risk for breakthrough seizures compared to some of these others with maybe that controversial risk. So we're going to talk a little bit about melatonin and magnesium, and these I will say are the two that are most commonly asked of, can I use these to help with my seizures, or will they help with my seizures? So melatonin is a naturally occurring hormone produced in the body, specifically in the brain. This is going to play a key role in regulating the awake and sleep rhythms in the body, as well as body temperature. Usually, our bodies produce enough melatonin where we don't need extra supplement, but sometimes in older patients or elderly, we may see that level start to decrease a little bit. Melatonin is thought to have beneficial effect on sleep latency, which is when patients are trying to lay at night, and that's the time that it takes them to fall asleep at night. So just tossing and turning, can't fall asleep. This is what it's thought to maybe have that beneficial effect with. Additionally, it may provide benefit in some patients with autism spectrum disorder or shift workers, so patients that are flip-flopping their schedule, not getting great sleep, or having, to sleep all day because they just worked all night, and then flipping their schedule to try to stay awake during the day. Melatonin is typically dosed, depending on the product you may find over the counter, 1 to 10 milligrams per day. I will say I usually recommend a lower dose, so towards that maybe 2 to 3 milligrams per day, because again, the body produces significantly lower amounts than that 1 to 10 milligrams a day. So if we can, have a lower dose and it works well, then great, versus using a higher dose that may put you at higher risk for side effects. So side effects for melatonin may include tiredness, headache, and dizziness, which also can sometimes overlap with our seizure medicines. So if you start melatonin as well as add a new seizure medication, these can sometimes muddy the waters of what do we point fingers at that cause that headache or cause that dizziness. So it's important to let your doctor know if you are starting this, or doing this in conjunction with other seizure medication changes. So what do we know about melatonin and epilepsy? So there's some proposed mechanisms that melatonin may have some anti-seizure properties, but this really comes from animal models, which is hard to extrapolate to human models. So there also is limited data in humans for anti-seizure benefits with melatonin. There was one study that looked at all the studies published, and they saw that melatonin treatment improves sleep latency, so that ability to fall asleep quicker, and then seizure severity compared with placebo. This was short-term data that they looked at, so they didn't look at melatonin use for years and years. This was very short-term that they looked at the studies with. And I will say overall, there may be some benefit. Again, triggers for seizures include lack of sleep or poor ability to sleep. So if melatonin helps with sleep, that's maybe why it's helping with seizures. But overall, it's, I would say, not a medicine that I would recommend to replace an anti-seizure medication or use as an anti-seizure medication, again, because there's not great data. And if someone wants to give it a try and it helps with their seizures, great. If not, then I would say, and it doesn't help with sleep, then I would say that's something where we'd maybe consider discontinuing. But overall, this one is not, the data that's here is not able to, again, replace that seizure medication. And then the next one we'll talk about is magnesium. So magnesium has lots of different roles in the body. So it can help with enzyme function, cellular function, help with that DNA creating proteins as well, and lots of other functions. We get magnesium through our diet. So sometimes if there is decreased magnesium in the diet, magnesium can sometimes be lower. And there are many different ways to help supplement magnesium taken orally as a tablet, aside from dietary intake. So the first one, we'll only highlight 3 of them. There's many others or multiple others, but we'll highlight the top 3 that I see typically. So magnesium citrate is typically used for constipation. So this is going to be in the liquid bottle. And that one can also raise magnesium levels, but it also can cause quite a bit of diarrhea, especially if a patient is not having constipation. Magnesium oxide is another formulation in tablet form that can be utilized. This one can also have some GI side effects or that increased bowel movements. And then magnesium glycinate is thought to have less of those GI side effects, so not as impactful with the bowel movements. Side effects for magnesium, so at low over-the-counter doses is pretty well tolerated. Again, we can have that increased bowel movements. When you start taking too much magnesium, that's when we can get an issue. And if you have a high level, that is a whole nother issue in regards to other things other than seizures. So I would say let your provider know if you do take magnesium, and they can just make sure that level is in normal range. Low doses or over-the-counter doses are typically dosed at 400 to 800 milligrams per day. So how does magnesium impact epilepsy? So I will say this too also has very, very limited data, and some of the data is from animal studies. And those animal studies showed that if you do have low levels of that magnesium in your system and you correct that, that can impact seizures. But overall, I will say in human studies, there's very limited studies for use in epilepsy. I would say the one with the strongest evidence is in preeclampsia and eclampsia. So this is a pregnancy disorder that can happen, that can actually cause seizures. This one actually showed that there was an improvement in seizures with magnesium supplementation. Some studies also showed that there may be a potential benefit if magnesium is low, and that's a risk factor for seizures for that patient. Correcting that may help. And then one study showed that there may have been a potential benefit in patients that use magnesium in combination with anti-seizure medicines, specifically for infantile spasms. So overall, similar to that of melatonin, very limited evidence. I, again, would not utilize these medicines as an anti-seizure medications. But again, if a patient has eclampsia or preeclampsia, I may reach to magnesium to help with that. But in someone that has a normal magnesium, I would say we probably won't see seizure reduction with this magnesium. And the last topic we'll talk about is herbal supplements. So are herbal supplements safe because they're natural? Many people will say, yes, they're safe, they're natural, but think of poison ivy. Poison ivy is natural. Is that safe for everyone? No. Just like poison ivy, a lot of our herbal supplements that are natural may not be safe in every patient. They can cause side effects. They can impact the liver. They can impact the kidney, etc. And additionally, they're not regulated like our prescription medicines. So our prescription medicines have the FDA seal of approval, where the FDA is making sure that that drug company is putting that specific medicine in that pill at that specific strength So our herbal supplements are not regulated like that. No one's saying, oh, this has that correct amount of that herbal supplement. No one's regulating that, or regulating what else is in that product. So that I think is very key to note, that although it's an herbal supplement, it's not being regulated like our prescription medicines. And then herbal supplements are not known to help seizures like our prescription anti-seizure medicines. So just like our over-the-counter medicines, they should not be replacing our anti-seizure medications. And then additionally, some herbal supplements can cause anti-seizure medicines levels to increase or decrease. They can additionally worsen seizures by not impacting the anti-seizure medicine. So they can just impact that seizure threshold because they may be passing through that blood-brain barrier, impacting the ability to have a seizure. And then they can also cause side effects that may be confused with the side effects of our anti-seizure medicines. So it's important that if you are starting an herbal supplement, you wait until all your changes are done with your anti-seizure medications, again, so we don't muddy those waters of not knowing what to point fingers at of what is causing what. There are so many herbal supplements. So every time I get a question for an herbal medication that someone wants to start, I typically look it up to make sure that it's going to be playing nice with their specific seizure medication regimen and making sure that it's not going to be impacting their seizure threshold or having the ability to worsen seizures. Again, just because there's been no reports of these herbal supplements impacting seizures does not mean it cannot impact seizures for every person. And these are just a couple listed here that can potentially worsen seizures or interact with our seizure medicines. So just to summarize with our herbal supplements and over-the-counter medications, that they can be beneficial for some people for some specific indications or reasons why they're taking it. But I would say for these, always talk to your doctor before starting, especially if they're not urgent. So the provider may be able to weigh those risks and benefits. Because if we see a risk of it impacting your levetiracetam level and now your level is going to be decreasing, putting you at higher risk for seizures, does that outweigh the potential benefit that this herbal supplement may be providing you? And typically the answer is no, but again, that's something that you would talk to your doctor about to make sure that they're weighing those risks and benefits, to make sure that you're going to get some benefit versus potential harm from those. So some key takeaways from today's presentation is that prescription anti-seizure medicines are key for the treatment of epilepsy. And some over-the-counter medication, prescription medication, and herbal supplements can impact the risk for seizures or interact with our seizure medications, which will put patients at high risk for seizures or side effects. And it can also make that new medication being started not as effective. So if able, again, non-urgent medicines, always talk to your doctor before starting to, again, weigh those risks and benefits and make sure that we're getting bang for our buck with starting that new medicine or stopping that medicine. And that is all I have for today, and I would be happy to answer any questions. I saw some coming through the chat, but what questions does everyone have today?
Yeah, no, thank you so much, Nicole. I know I found a lot of that helpful. We get a lot of calls here at the Epilepsy Association about when do I take a missed dose? So I found that really helpful. I think a lot of folks will too. I do see we have some questions in the chat. Genesis asked, I had heard that there were some food like grapefruit that could impact the effectiveness of some medicines. Do you have any feedback on that?
Yeah. So grapefruit, I will say, is a red flag one for food. I didn't dive into food today, food interactions with our seizure medicines. But yes, grapefruit is one that can potentially impact our seizure medicines. So it impacts CYP3A4, and a lot of our CYP3A4 medicines are seizure medicines. So these would be ones where I would probably just double check, make sure if you are consistently using those grapefruit juice or eating grapefruit that your doctor is aware and making sure there's no significant interactions.
We had another question about, did you have anything on possible interactions with anti-anxiety medications? I didn't know if that was too broad or.
Yeah, so I will say most of our anti-anxiety medicines play pretty nice with our seizure medicines. I will say one that I'm more cautious with, which is a rare seizure medicine of fenfluramine. That's one where I would be a little bit more cautious, or at least make sure the provider knows that you're on that, because both of those work on serotonin. So I will say a majority of the anti-seizure, anti-anxiety medicines play pretty nice, but that's just a general statement. There are some that do interact with some of our seizure medicines. So I won't go through every single anti-anxiety medicine, but in general, they play pretty nice.
Awesome. Someone asked if you would be able to show the list of the herbal supplements that could worsen seizures again. Um,
Here.
thank you.
And this is most definitely not comprehensive by any means. There's a lot.
Um,
So I would say if any of them that you're on, I would just reach out. That's usually what I recommend, is always reaching out.
could you also address, someone asked, could you also address vitamin D and folic acid supplements?
Yeah, so folic acid is really utilized for women or female of childbearing age that have a potential to become pregnant, and that helps with what we call neural tube defect to help limit or lower that risk that may come with some anti-seizure medications. So typically anyone female of childbearing age, we recommend to be on that does have that potential to become pregnant. Because that essentially protects the baby. And usually we recommend, even if you're not trying to become pregnant, to still recommend utilizing that to, again, because most people don't know that they're pregnant until about 4 weeks. And we want to protect that baby even in those first 4 weeks. And then for vitamin D, I will say some of our seizure medications put some patients at higher risk for osteoporosis, or what we call brittle bones. So vitamin D can be utilized to help strengthen those bones in addition to calcium. But that's my little 2 cents on those two.
And then looks like we have one more question from our last question from Carl. Some supplements can be bad for people with epilepsy, including ephedra, ginkgo, ginseng, St. John's wort. These supplements can trigger seizures or make anti-epileptic drugs less effective. Is this true?
Mhm. Yep. Yeah, those are some red flag ones. Yeah, St. John wort is a big one for drug interactions. Ephedra is one that's more of that stimulant type medication that can impact seizures. So yeah, those are true for those. But again,
Any
St. John wort doesn't interact with all of them. So that again would be a good question for your doctor if you did want to start taking those.
Awesome. So it looks like that's all the questions. I just wanted to thank you all for joining today's online seminar. I hope you all found this information helpful and informative. We will be sending out a brief email survey at the conclusion of the seminar, so just keep an eye out for that. Additionally, I just wanted to thank our sponsors again, and make note of some upcoming Epilepsy Association events. This was the first seminar of the year, so be sure to take a look at our other seminars available throughout this year. And then we also have several other special events coming up, including our 5th annual golf outing at Sweetbriar Golf Club in Avon Lake, and that's going to be on June 23rd. Registration will open soon. Thank you all again for attending this seminar. We hope to see you in the future. And thank you so much, Nicole. We really do appreciate it.